Thank you for joining us for this conference and for my presentation on outdoor adventure ed and risk management in COVID-19. I think you're going to find the content to be interesting. My name is Leonard. I use he, him, and his pronouns. I work for the Sierra Club inside of our Outdoors for All campaign, and I do research with Prescott College and the University of Utah. And what I'm about to present to you today is the initial results of a study that a fairly large research committee put together at the beginning of the pandemic, looking at all of the different impacts that we've had to our outdoor adventure ed and wilderness therapy programs following the pandemic start in March of this year. With that, I'm going to go ahead and go through this. I am looking at the chat window. I'm not looking at a screen of faces. So if you have a question of any kind while we're presenting and you really want to get it out there, that's fine. But I don't plan to stop until the end to answer specific questions. And I'm also going to ask us to do a small breakout group to discuss some of the meaning behind what we present. This is meant to be experiential in some instances, so we'll have a chance to interact at the end. And I'm very much interested in hearing from all of you on the meaning behind the data I'm going to show. We're about to start writing up our paper on this material, and we want to. This is the third presentation we've given, and each time we've come away with a little more understanding from the field about what our data could actually be telling us. All right, with that, I'm going to get into it. So here's our agenda. I'm going to introduce you to the project, the methodology we used, our findings. We're going to have a chance to do some discussion, and then I'm going to share the conclusions that we are currently discussing amongst the research committee. And then I'm going to invite all of you to participate in a follow-on discussion, as well as to participate in our project. So here's the project intro. The purpose of our study was to essentially gather the impacts of COVID and all the different solutions that people in our field were implementing in order to maintain their operations. And we looked at a vast number of groups. I think we have 125 respondents right now, representing primarily outdoor adventure education, outdoor behavioral health, and the college and university outdoor recreation programs. So you'll see from the results that while there's some commonality and generalization with data at some elements of the data, much of what we brought or was able to ascertain from the field was really dependent on the category of organization that we were interviewing. We primarily want to see what specific physical changes people are making to their organizations and how they envision maintaining their sustainability for the next 1 to 3 years. Our committee included academic researchers from a number of universities. You may recognize some of the names here. It also included the executive director from the Association for Experiential Education, Sherry Bagley, and then co-chair of the research committee from the Association for Outdoor Recreation and Education, Eric Rabinowitz from Appalachian State University. And it was sponsored by the Sierra Club. My co-lead for the program or for the project is Alan Ewert. He's a professor emeritus out of Indiana University. Some of you may be familiar with his name as well. And then another pretty well-known member of our community is Denise Minton at Prescott College, and she's my direct mentor for this project. So here's our question. How were organizations in the outdoor adventure education fields impacted by COVID-19? And I'm going to do real brief methodology here because this is not really part of the meat of the discussion. We're currently in phase 4. We designed 4 phases for the project. In phase 1, we interviewed 12 organizations, primarily in outdoor adventure ed and outdoor behavioral health, on the phone surveys. And from those interviews, we designed a survey instrument. That was in May of this year, at the beginning of May of this year. In phase 2, we fielded that survey instrument to almost 100 organizations, all of whom are accredited by the Association of Experiential Education, or organizations who had won an organizational leadership award at AOR, at the Association of Outdoor Rec and Education. So the idea being that at the since phase 2 was in the beginning of June through the first week of July, organizations who were accredited by AEE or had won that award at AOR, we felt that they would be in the best position to provide us feedback as to what they did and to answer the survey itself. 51 questions in the survey, most of which were open questions. And the survey was designed around themes, 4 different themes and a set of general questions. And you'll see those themes come out here in a minute. Phase 3 started at the latter half of July. We only added 1 question from the phase 2 survey to the phase 3 survey. In this case, we submitted that survey out to the membership organizations of AEE and AOR, as well as the Society for Outdoor Recreation and professionals, and to an organization called Nature's Grace, run by the University of Utah, which is much like this conference we're participating here at Cortland, but it's for organizations that run programming for military veterans. So that was phase 3. It concluded in September. We had 85 responses, usable responses. That's pretty good return rate for us. And then we entered phase 4 in September, and we're currently in phase 4 now. We have a phase 4 survey active, and as I mentioned, I'm going to provide a link for you to access our phase 4 survey if you or your organization wishes to participate. Here's the respondents. In phase 2, you'll see 3 different categories. OBH is outdoor behavioral health. OAE is outdoor adventure education. And then we use the acronym HA to indicate that the organizations in that category had a higher administration. So those are all colleges and universities. So when you see HA, that means college or university or school. There's a few grade schools that responded to us as well that run outdoor programming in their campuses. What's significant from just this simple response, we asked, are you open or closed? And in both phase 2 and 3, 41% of the organizations reported being closed. That is significant. The next slide I'm going to show you is a reduction in employment because of those closures. What's also significant is none of the outdoor behavioral health organizations closed, and none of the outdoor behavioral health organizations reported any loss in their employees. Everybody maintained or increased their employee strengths at their organizations. Everybody here changed their operations. OBH changed their operations significantly. They just did not close any doors. So 41% of closure is with the outdoor adventure ed and also with the colleges and universities, which should come as no surprise if you work in a college or university. And that the reality is that caused a number of folks to lose their jobs. And in phase 3, when folks filled out our survey, 51% reduction in employment. So the phase 3 responses, again, there was 85 responses, 85 organizations responded, representing 2,500 employees, and they lost 51%. 50% of their employees have been furloughed or laid off when they responded to our survey. So the total average is 45%. So I say right now, today, it's safe to say about 50% of the organizations that are included in our study had laid off their 50% of their employees have been laid off. Nobody from the outdoor behavioral health field was laid off. So let's get into the meat of the discussion, some risk management findings, and then some general findings from the rest of the organization. So here's what we discovered, or what we were essentially told by our respondents. There was a number of risk management concerns. One of our questions was, list your top 3 risk management concerns. So all of these top 6 were mentioned multiple times by multiple organizations. And I want to go over each of these in particular, because I would love to have some follow-on discussion on these 6 management risk management concerns. So at the very, the most common response to that question was, how do I maintain a physically and emotionally safe environment for my staff and clients, especially at the beginning of the pandemic? No one had really figured out how to do that responsibly. Everybody was reacting and responding to local health requirements and state requirements and mandated closures and then phased openings. And all throughout that time, in order to do in-person, how do they maintain that physically and emotionally safe environment? The outdoor behavioral health group went right to virtual work, and they obviously did that physical distance by not getting together in person. A number of the outdoor adventure education programs really rely on that in-person interaction in their experiential programming. So they were attempting to re-enter that in some capacity. One solution that we saw in a number of instances had to do with ropes courses. And if you're familiar with a ropes course, you often have a low ropes and a high ropes course that work with a group. And they essentially just closed down their high ropes course. They were able to manage a low ropes program and maintain that physical distance. In other words, providing that physically and emotionally safe environment. And when we talk about emotional risk around that safe environment, a number of organizations consistently reported that they were concerned about their clients' emotional safety. The stresses involved of the pandemic, and especially those organizations that were working with clients who had a mental health need, in the OBH field in particular, they're concerned about their the emotional risks of their clients. And in their case, with OBH, it wasn't so much the emotionally safe environment of returning to the campground. It was, now that I'm working with my client remotely, how do I continue to provide for their emotional safety remotely? Second bullet is how to respond to a client staff member developing symptoms. Now, this was a big concern amongst everyone. What do you do if you're running an outdoor program, let's say a camp in this case, and somebody develops symptoms? And if you're not familiar with COVID risk management, there's 3 primary symptoms that if you see 2 of them, you need to be making a decision. And that's a fever of 100.4 degrees or greater, persistent coughing, and difficulty breathing. And difficulty breathing can be tested by doing a breath hold test. So if you have the ability to check your participants during the day, the concern was, well, what do I do if somebody has a 100.4 degree temperature and they're having the difficulty breathing? What's my next step? They're also concerned with how to safely mitigate the constraints around transportation, tenting, cabins, dining facilities. There's a number of instances where social distancing standards would be difficult to implement. In many cases, especially with the higher ed, with colleges and universities, they just simply eliminated all of their transportation. So they're no longer doing any type of activities off campus. And that may work for some, depending on where in the country they're at. One of our respondents is a northern campus, and they initiated a Nordic skiing program on their campus once winter hit. However, if you don't have that opportunity to do on-campus activities, say you're an urban community, you may be challenged if you eliminate your transportation to provide your outdoor programming. Another concern was how to prevent or lessen the likelihood of the program being closed by the health department or not being allowed to reopen due to government regulations. And that risk management concern was directly related to income, primarily with organizations that are a fee-based organization. So they're relying on their program, their client fees to pay their bills. Concerns around local medical capacity. Now, this is an interesting consideration. If you run an outdoor program in a rural environment and you're not aware of what the medical capacity is for that hospital, you should be. Because if that hospital has room for COVID-19 patients, but not room for a fractured leg, then what are you going to do with your client who's broken their leg? So some of the organizations who responded to being closed in particular told us that they closed because the local capacity for treating routine injuries and illnesses no longer existed. due to the need to reserve those beds in those hospitals for COVID-19 patients. And then lastly, increased barriers to participation, which is another significant outcome of the pandemic, is the marginalized populations that may already have barriers to participation now have greater barriers to participation. All right, I'm going to go through some specific findings, and I'll do this real brief because it's not that complicated. Essentially, no organization was prepared for the pandemic, and no organization in our study has figured out how to operate during the pandemic without a measurable impact to their operations and clients. So regardless of category, location, size, or the age of their organization, or their funding levels, nobody knows how to operate during this pandemic at their previous level of operations. So essentially, they're having to reinvent much of what they do and how they present themselves. No organization has determined when the pandemic will no longer affect their operations of their clients. Even when asked what happens after the pandemic is no longer a pandemic, let's say that we've mitigated or eliminated COVID-19 in our society, the respondents indicate that they're still going to have to make long-term changes to their programming because they don't see that this concern as going away. They feel that they're going to have to incorporate the risk management practices that they've developed during the pandemic permanently. And that means to them that much of their outdoor activities are going to have to be adapted to be more friendly to the different COVID-19 constraints that are in place. All organizations, regardless of category, have adopted policies. That seems to be something clearly that folks would want to do, but that is the case. Some had much more difficulty than others. A larger organization or an organization that has an administrative headquarters above them, like you would find in a college or university, may have a standalone risk management department or division or team. The smaller the organization, the less likely it is that that's the case. In some cases, the program administrator themselves was not only responsible for their budgeting and their logistics, but also for their risk management. And they were most interested in finding somebody else's risk management plan and just applying it to their own program. And then some organizations had a unique response that they created teams of employees who were specifically trained in greater detail and had better equipment to respond to a COVID-19 potential infection. And that would be the team that would really understand the standard operating procedures on how to respond to a potential infection at a camp or during an outdoor activity, allowing the seasonal staff to not have to spend as much time training on COVID-19 response. Organizations sought solutions from the membership organizations they belong to, such as AOR and AE and the WRMC. They participated in conferences like this to learn what they can, very much interested in what other organizations are doing. In all, most organizations found that they learn more from their peers and from science than from anybody else. So they would make their own risk management decisions based off of what their peers have done and what they're being told scientifically is the steps they need to take to mitigate spread of COVID. Multiple organizations asked for risk management protocols that allow for acceptable operational levels. So again, this gets to this idea that perhaps many outdoor adventure ed programs are not going to return to their previous operational levels. And then all organizations that provide client transportation indicated they're no longer doing so. Some have started to provide transportation again, maybe 50% capacity of a bus, for example. However, if you're not providing transportation, you're asking people to drive themselves. There's a sustainability issue with that, having more cars on the road. And there's also an additional risk issue from having more drivers. And then when you're asking, when you're going from one van to 5 vans to provide transportation, it gets back to an increased risk, physical risk of the drivers, and then a sustainability issue around multiple vehicles in place of one. So there's a lot of back and forth on how to solve a client transportation issue. When asked how organizations incorporated technology, these next three bullets are all about technology, because a lot of us saw in our workspace that technology and working from home became pretty prevalent. But some of the larger organizations didn't see that as feasible. Outward Bound, for example, in the different schools that replied to our survey, they just closed themselves down and stopped providing any type of outdoor activities. Other organizations like OBH latched on to the use of technology as this is how we bridge the gap between now and when we can get back together in person. The organizations that did better in this case had already incorporated technology within their companies or within their organizations. The ones who completely refuse to incorporate technology of any kind are all still closed. So there's definitely a give and take on whether or not to incorporate technology. For the outdoor behavioral health group, again, of significance, there were 17 respondents. None of them reported being closed at the time they completed our survey. All their staffing levels remained steady. There was an increase in telehealth and other remote activities. And in many instances, it seems that the OBH programs qualified as essential services by their local governments. So there's a national standard for essential services, and then each state typically has a different standard, if not, be similar, but not exactly the same as the federal government. And then when you get down to the government level that has authority over these programs, it's going to be at the county level in some cases. In some cases, it's the state level, depending on where in the country they operate. But what's important for them is that they knew where to go to determine whether or not they were essential service, and that allowed them to remain open even during mandatory closures. For the outdoor adventure ed respondents, we had 54 of those. 41% closure rate is significant, especially if you're finishing your undergraduate degree and are looking to work in the outdoor adventure education field. That's a pretty significant loss of job opportunity. Seeking risk management solutions and program options, anything that allows them to survive until things get back to normal. In phase 3, our survey respondents were still indicating that they were looking to get back to their formal level of operations. We have some respondents from our phase 4 survey, and we see that organizations are shifting their mindset to, okay, how do we recreate our program offerings, our outdoor activities, to have the same outcomes for our clients and have activities that are more able to adapt to COVID-19 restrictions, especially when it comes to proximity to others and how we can clean and disinfect equipment and spaces like a dining facility or a common room. These organizations are the ones who really closely follow their membership orgs because they're looking for help from their peers and from these different membership orgs to give them material they can use. ACA, for example, the American Camping Association and the YMCA of the USA co-created a risk management template for camps during COVID-19 that's freely available on their website. So that is the type of information these organizations are seeking. What's significant there is that all 4 of these membership groups already provide a lot of information to their clients or to their members. And even more so, if you go to the AOR website, you'll find some very relevant COVID-19 guidance that's designed for outdoor adventure ed, for college rec programs. A lot of people sharing what's working for them and what's not working as they're trying to reopen their facilities. And then OAE had greater concerns regarding staff retention, especially around how do we hire somebody back who's been gone for 6 months? What's their skill level at now? What kind of training do we need to put them through? Have they lost their technical skill qualifications? How do I restart my climbing program if I don't have any qualified staff to restart my climbing program? So a lot of those qualification and credentialing questions were also addressed by some of the credentialing organizations that provide the different, like a wilderness first responder or whatnot. And in many cases, you'll see an organization like Knowles has extended the amount of time you need, or the length of your qualification being valid, but that doesn't necessarily equate to you still knowing what you're doing. So that was the concern with OAE, is that folks are going to lose their skills because of a lack of use. And then when it's time to start up again, we really just want to get back at it, but we can't just get back at it until we've trained our folks and ensure that they can do those skill requirements again. In the universities and colleges, we had 43 respondents, 42% closure rates, and a lot of concern with program viability. So especially with smaller departments, they've had to close their indoor climbing gym, and they've had to close their rental facilities, so they're not renting out rafts or kayaks or anything like that during the week or on the weekends. They're not running 2 and 3 day backpacking trips off of campus during the semester. So now they're down to just a small staff of 1, 2, 7 folks in their office, and they're trying to determine, if this keeps going, when are they going to cut my program? As the budgets get cut at the university, when are they going to cut me? Because right now I'm not doing anything. So a number of groups responded that they were looking for ways to be valuable across the campus in other ways. They were trying to explore other ways, including working with the campus staff and the campus and the other employees there in their own health and well-being programming, and how they can incorporate what the university traditionally offered to the student population to help the staff members of the university and their families as they're working through the COVID pandemic. These programs obviously have less control over their operations and finances. The respondents confirmed that to us. Many frustrations, and if anybody in the room is from a university, you probably know the frustrations yourself, that you run an outdoor program or you're part of an outdoor rec program, and you really have no control over when you can open or when you're going to close. You might have some impact to your finances, but you might also receive a lot of that from student fees. So you have a different level of concern, or different types of concerns, when compared to the OAE and the OBH groups that operate more like a small company. And then they're discovering, like I said before, because of that viability, they're discovering ways to work with or partner with other departments. So here is where we would like to break into small groups. Let's see how many folks we got.
Right now we have 34.
Great. So take a minute and note the question in the that I put up here as a prompt. Please spend the next 10 minutes. We're going to go for 10 minutes. Share how COVID has impacted your organization or your work. And Natalie, if we can do groups of 4, that'd be great. And you can just put me in one of those groups. Share how COVID-19 has impacted your organization or work, and discuss any solutions you have seen implemented that have mitigated the impact of the pandemic. And if you would, when we come back together, if you would type in some of the responses into the chat window, I would appreciate that. All right, Natalie, whenever you're ready. Awesome. I hope you had some productive conversations. We're going to let people share inside of their chat windows here. Let me stop sharing the screen. And maybe we can have some conversation. We have about, looks like 19 minutes before we need to end the presentation. So I would like to spend some time with all of you learning some of what's happened to you and your organizations. I'm interested, of course, our team is interested in how you have operationally survived, but we're also interested in the effects to the clients. And what is it like on a campus if you go from a very robust offering to almost no offering? And you've got students on campus now that are not having that opportunity to access the different outdoor activities that you normally would provide. Or if you run a program for youth, what it's like for the youth who are not having that opportunity to participate in an environmental ed program, for example. So if anybody wants to type into the chat window that they'd like to share, I can call you up to speak if you want. You can also cut and paste in something from the conversation you just had. As an example, one of the participants in my small group that works at the university mentions an increase in rentals on campus, which seems to indicate there might be an increase in nearby nature. And then that would require us to look at, well, how well is this nearby nature maintained by the local authorities? So anyone? No one wants to share? Come on, you get so much knowledge in the room.
Aaron, hi. I'm Beth. I'm from the Syracuse VA Medical Center.
Hello, Beth.
Hi, Beth.
Yeah.
It's okay. I'm going to share my partner and I. My partner works he's a student, but he also works at Bristol Mountain. He's had the program started late. They are sanitize their equipment after every use. They do a daily survey of symptoms, mindfulness of social distancing, and give other groups space. Here on the inpatient level, we have 3 units that we take care of primarily. The long-term care unit, those individuals are, I don't want to say quarantine, but advised to stay in their room for the majority of the day. A few of them come out for meals, and there are 1 or 2 recreation programs. I think only one that they're allowed out of their rooms for, and that's bingo. Our spinal cord injury rehab unit. A lot of those individuals, besides their therapy appointments with physical and occupational therapy, they are pretty much in their rooms. In the nicer weather, we were taking those individuals one at a time out to the patio. And on the acute mental health unit, nothing really changed. We were still doing groups because that's the primary focus of this unit. Veterans are supposed to wear masks. And even though it's a small unit, we try to comply with social distancing. Everything is wiped down. We're screened every day we come in. All the veterans are put through a COVID check. When the whole program started, when we were all shut down, many of the therapists worked 2 days or 3 days here and 2 days at home because of the decrease in group size and things like that. That's pretty much how we've been doing it. And we used a lot of technology. We started to use a lot of technology with the iPads and letting the veterans speak with their relatives, especially on the long-term care unit. We're doing a lot of our meetings on the internet and, web CT or whatever. And even, the doctor's appointments, outpatient level are done, via Zoom or something like that. So I covered my end.
Thank you for sharing that, Beth. We have time for one other person to share. Again, the questions being how you might have changed your operations. Perhaps you've had to furlough most of your staff, or the impacts that this has had on your clients. Anybody's thoughts? Has anybody looked to make long-term changes to their programming? Like long-term permanent changes to their outdoor activities? Or are you still thinking we might be able to go back to normal at some point?
I work at a summer camp, and we're trying to plan for all of our contingency plans of next summer without really knowing what it's going to look like. But our hope is in, a few years that we will be able to go back to what we were or what it was. But, I feel like there's just so many questions that are still up in the air that it's hard to know if we're going to be able to. So here's for the optimism.
Yeah, there's nothing wrong with a good dose of optimism. How about if we go back to the last slide? I want to share some of our conclusion statements with you before we end. And then I want to make sure everybody gets a chance to grab the web link to participate in our survey. So conclusions. This is not an all-inclusive list of conclusions. This is just kind of some surface observations from us. One interesting outcome we've seen is that the organizations that have done better, even if they had to close their doors, had a much greater level of readiness. If an organization has gone through an accreditation program, if they've had somebody come in and look at how they operate, everything from their financial management to their risk management, they seem to do better during the pandemic because they had a higher level of resilience, of organizational resilience. Small organizations that offered one or two types of outdoor activities, and for example, one of the respondents provided a sailing type experience on a single ship. They had no other program offering, so they're closed, and they may be permanently closed because their portfolio was very small. Some organizations that had maybe a dozen different types of activities were able to find the ones that worked best under the COVID-19 constraints and maintain a level of operations while closing down the activities that were not really conducive to COVID-19 risk management. Higher levels of readiness were also directly connected to leadership. So that's the second conclusion. Some organizations, when asked, were they prepared for the pandemic, simply stated that they were not prepared. How could anybody be prepared for this? Other organizations answered more along, well, we weren't prepared for a pandemic, but we are prepared for economic hardships or a something like a hurricane, a natural disaster, which a pandemic could be classified by some as a natural disaster. So the leadership that was more able to adjust on the fly, so to speak, to the constraints of the pandemic and make very timely decisions, and they chose correctly which direction to go, were able to maintain operations, whereas others whose leadership, maybe they maybe their leadership was a couple of levels above that outdoor rec department, or maybe their leadership was just the wrong leader at the wrong time for the organization. They faltered and would end up having to furlough more folks or close their doors because of their inability to make a decision or determine the best course of action. Of course, some organizations just fell into the unfortunate circumstances of being in a part of the country where very strict stay-at-home orders were implemented, so they had to close their doors. But in some cases, it was a leadership failure that caused organizations to fail or to close. And that called into question for us this, we have a follow-on question for our phase 4 that's going to be focused on how do organizational leaders develop inside the field of outdoor adventure ed and wilderness therapy. What kind of, is there a process that the more successful leaders went through that allowed them to develop those skills that have been more useful during the pandemic than others? And then finally, for risk, our conclusion here is that there's, as we know, if you work in this area, you have a lot of different ways to look at risk. From an organizational standpoint, you may be concerned with financial risk along with physical risk. And then when you're working with your clients, you might concern yourself with their perceived and actual physical risk, as well as their emotional risk and their social risk and their spiritual risk. So there's lots of different levels of risk to look at. The most successful organizations during the pandemic were concerned about their operational risk, so those physical things they had to do differently to mitigate transmission. They were definitely concerned about the risks to their staff and the risks that their staff brought to the organization. So staff that lived off campus or outside the program, like most do, what's their chance of exposure and then coming back in for their next shift and bringing COVID with them. And then very much concerned about the risk to their clients, not just the physical risk or emotional risk during a program, but for clients who no longer had access to their outdoor program that they normally would participate in, what kind of risk does that create for their clients as they remain at home? So we're still collecting data, as I mentioned. That QR code would take you directly to our survey, which you can do on your phone, and then there's the SurveyMonkey link. There's my email address. If you want to know more, or if you're interested in me sending you this link, for example, please send me an email. It's my first name dot last name at sierraclub.org. And I encourage anybody who is in a leadership position in an outdoor program to participate in the survey. If you work for an outdoor program, we would appreciate you passing the survey along to your leadership. We're interested in what organizational leadership has done to mitigate the impact of COVID on their organizations. And with that, I think we're done with this.